In assessing the motor system, observe the patient's body position during movement and rest. Watch for involuntary movements. Inspect the size and contours of muscles. When inspecting for atrophy, pay attention to the hands, shoulders, thighs, and legs. Assess the patient's muscle tone by feeling the muscle's resistance to passive stretch. Persuade the patient to relax and flex and extend the patient's fingers, wrist, elbow, and shoulder. Assess muscle tone in all four limbs. Next, assess muscle strength. Test flexion and extension by having the patient push and pull against your hand. Test extension at the wrist by asking the patient to make a fist and resist as you press down. Test the grip. Ask the patient to squeeze two of your fingers as hard as possible and not let them go. Test opposition of the thumb. Ask the patient to touch the tip of the little finger with the thumb against your resistance. Test finger abduction. Instruct the patient to prevent you from moving any fingers as you try to force them together. Next, we move to the lower extremities. Test flexion at the hip by placing your hand at the patient's mid-thigh and asking the patient to raise the leg against your hand. Test extension at the hips. Have the patient push the mid-posterior thigh down against your hand. Test extension at the knee. Support the knee in flexion and ask the patient to straighten the leg against your hand. Test flexion at the knee. Tell the patient to keep the foot down as you try to straighten the knee. Test foot dorsiflexion and plantar flexion. Muscle strength is graded from 0 to 5. Next, we move on to the sensory system. It is important to compare symmetric areas on the two sides of the body, including the arms, legs, and trunk. Ask the patient to close his eyes. In the video, I was testing pain sensation in the suggested pattern of both shoulders, the inner and outer aspects of the forearms, the thumbs and little fingers, fronts of both thighs, medial and lateral aspects of both legs, the little toes, and the medial aspect of each buttock. In assessing for pain, ask the patient whether the sensation is sharp or dull or whether the sensation feels the same on both sides. Do the same technique for light touch and temperature, and you may also test for vibration sense. Lastly, we have muscle stretch reflexes. First, encourage the patient to relax and position the limbs properly and symmetrically. With your wrist relaxed, strike the tendon briskly using a rapid wrist movement. So for the biceps reflex, the patient's elbow should be partially flexed and the forearm pronated with the palm down. Place your thumbs or finger firmly on the biceps tendon. Aim the strike with a reflex hammer directly through your digit toward the biceps tendon. Your strike should be quick and direct, not glancing. Note the speed, force, and amplitude and grade on a 0 to 4 scale. For the triceps reflex, support the upper arm. Ask the patient to let the arm go limp as if it were hung up to dry, then strike the triceps tendon. For the brachioradialis reflex, the patient's hand should rest on the abdomen or the lap with the forearm partly pronated. Strike the radius with the point or flat edge of the reflex hammer about 1 to 2 inches above the wrist. Watch for flexion and supination of the forearm. Next, for the quadriceps or patellar reflex, you flex the knee. Briskly tap the patellar tendon just below the patella. Note contraction of the quadriceps with extension at the knee. Next, the Achilles or your ankle reflex. If the patient is sitting, partially dorsiflex the foot at the ankle. Strike the Achilles tendon and watch and feel for plantar flexion at the ankle. For plantar response, stroke the lateral aspect of the sole from the heel to the ball of the foot, curving medially across the ball. Closely observe for movement of the big toe, normally plantar flexion.